Hey everyone, welcome back. This week I'd like to introduce Dr. Hannah Williams. Dr. Hannah joined us in mid-December. Could be more excited to have her here. She is a women's health expert. She is specifically a pelvic health specialist. Her schedule is filling up quickly. If you have any questions in those areas, if you'd like to talk to her about physical therapy as it relates to women's health and pelvic health specifically, please reach out. So this week, Dr. Hannah is bringing to us the eccentric adductor slide exercise. So as you might guess from the name, we're talking about the inner thigh muscle here, the adductor muscle. So in terms of pelvic health, in terms of hip strength and stability, the adductors are many times neglected, often overlooked. For many of us, we try and stretch those muscles. Those muscles get tight, they get irritated. We can tell that the hips are tight specifically because of those inner thigh muscles. We stretch and stretch and stretch and just don't seem to get anywhere. Maybe get a little bit of temporary relief, but that's about where it ends. And so when talking this over with Dr. Hannah, one of the things she mentioned, which is true for many muscles, but specifically in the adductor area and the hip area in general, is that when we're stretching, that will provide temporary relief, but those muscles will tighten right back up after a day, maybe after a couple of days, because the hips, the pelvis, even the spine don't feel stable. They don't feel well supported. And so those muscles will tighten back up in a strategic attempt to stabilize the entire lumbopelvic complex. So what needs to happen in that case is we actually have to take care of the other side of this equation. We can't just stretch. We also have to strengthen. So that's what's going on here. We have the hip isolated with the knees bent in this tall kneeling position. That kind of makes sure that we don't overuse the hip flexor. We don't overuse the quadriceps. We stabilize through one knee. Make sure that you have a soft surface, something that's comfortable. You're going to be leaning in. Most of your weight's going to be through this knee. You can see this knee, this hip is the side that is controlling the moving side. Also making sure that the opposite knee has a surface that will slide easily. So get in position, get tall, get into that tall kneeling position. Make sure you're squeezing the glutes and the hamstrings just a little bit. Get some stability there. Get those hips forward and neutral. And now that you're in place in that tall kneeling position, now we want to bring our breath into it, our core stability into it. Long, slow, silent inhale through the nose. Long, slow exhale through the mouth. Sigh that air out so that the ribs come down. That spine and those ribs get stacked into that neutral position over the belly button. Okay, so now that you're ready, go ahead and dig in with that grounded knee. Push the opposite knee, the sliding knee, push that away slowly and under control. We don't want to move too quickly here because there is potential for a strain, especially if we have weak adductors. There is the potential for a strain at those adductors, really at either hip. Slow and under control, dig that knee in, pull the sliding knee back. That first week, you're probably going to get sore. So you may only want to do 5 or 7 reps, maybe one set twice a day. As you get stronger, as you notice this exercise gets easier, you'll want to ramp it up to maybe 10, maybe 12, maybe even 15 repetitions, 2 sets. Make sure that you do both sides. Okay, that's pretty much it for this exercise. If you have more questions for Dr. Hannah about this exercise or about pelvic health in general, please reach out, give us a call. Thanks so much for watching. We will see you here again soon.